Hi everyone, it's Dr. Adam Dreisman here to talk to you a little bit about your 2-week postoperative knee visit. The first thing we'll do at your visit is we'll have you come and take some x-rays. These will be the first x-rays you take after the operation. This will serve as a baseline for us to be able to assess your alignment and its fixation to be able to compare going forward. So that's the first thing we'll do is obtain x-rays. Afterwards, we're going to take a look at your incision. Sometimes some individuals have clips closing the incisions and others have dissolvable sutures. We want to make sure that's healing well. It's not unheard of or not surprising to have that incision to be a little bit raised or a little bit bumpy. That tends to go down over the next few weeks, but we do want to make sure that the incision is healing well. Also, just point to note that if you do have dissolvable sutures, it's also not uncommon that sometimes about 6 weeks to 2 months after the operation, sometimes those dissolvable sutures sometimes come to the skin. If you do see that, just take a little bit of an alcohol swab, clean off that area, and then take that suture out with a tweezer. It's not normal, but it sometimes does occur. So we will look at the incision. I wouldn't be surprised to see some bruising around the knee, as we mentioned in the book. Typically, the swelling goes most around 7 days after the operation, but swelling's persistent, so I would not be surprised to see bruising, swelling going down the ankle. This leads to some achiness, so it's also not uncommon that when you get up out of your chair in the waiting area to come to the room, that's going to be sore for the first 5-7 steps. Not uncommon at all, but typically after you start walking, that achiness goes away. And then the next most important thing we look at in this visit is to look at your knee range of motion. Typically, we hope that your knee range of motion is from about 0 degrees to about 110 degrees. If you do get that motion by 2 weeks, you're an A student. At that point, we give you a report card that you're on the right track, but this is only a midterm. You got to continue to keep on working. We do take down your level of exercises a little bit, but again, it's very important that you maintain doing these exercises. If you don't do these exercises now and wait till 6 weeks, you'll never get that motion back. So it's very important to continue to stay on top of this to be able to get the most function out of your knee. If you're only able to go from 0 to about 100, 105 degrees, at that point we call you a B student. At that point, we'd want you to go to a postoperative physical therapy appointment just to make sure that you're doing the correct exercises, you'll be able to get the most function out of it. You just need to push it a little bit more to make sure you're heading in the right direction. If you're only able to go from 0 to about 90, 95 degrees, unfortunately, you're a C student at this time. This is really important that we really have you hit the ground running. Again, I cannot have you wait till 6 weeks because if you never get this motion by 6 weeks, it'll never come to you. At that point, I really need you to work hard with physical therapy, get you into physical therapy, really work on that motion because I don't want you to head to failure. If you head to failure, we have to go and do that manipulation under anesthesia, which pretty much puts you back at square one where I have to push on the knee and go back to doing all of these exercises and all this recovery again for another 6 weeks to 3 months. So that's really one of the most important things we're looking at this visit is to see how your knee function is going. But again, I do expect this knee to be swollen, to be warm to touch, tight. This is not the time to stop doing the exercises. Even if you're ahead of the game, continue icing. The leg is still going to be swollen. And it might not be immediately when you start at the beginning of the day, but definitely in the afternoon and the early evening. Ice the leg, elevate it, follow the book, follow the exercises. And hopefully we're heading on the right track and we'll get you back to your normal function. Thank you so much.